for help, it becomes a downward spiral. So I worked for 4 years in biofeedback and neurofeedback research. And I wrote an article for the American Holistic Nursing Association about the stress of implementing the new healthcare legislation. And so Debbie and I found each other because we both have a passion for using biofeedback because it's an objective measure. So you already know biofeedback. A mirror is biofeedback, a scale is biofeedback, a thermometer is biofeedback. Bio is just the prefix that means life, and feedback just means the information goes back into the system to make adjustments.
Well, that's an easy way to explain that. So the other thing that I was very passionate about and she told you the story with the sisters and learning about therapeutic touch. And so before we had our first meeting, we had talked about the biofeedback, and before we had our first meeting, I went down to Austin to do a training in healing touch. And while I was there, I was so inspired by the few simple techniques. It's just a couple tweaks that you could teach nurses in being able to manage their energy and to balance out their system so that they walk in a patient's room, they can really be there with that patient. Instead of going in and messing with the tubings and the IVs and you know, barely even acknowledging the presence of a human being in that bed, if we could get them out of that stress response and teach them a few energy techniques, they can actually go in and really connect and be a therapeutic presence and a healing presence for that person lying in that bed that is already vulnerable.
And Jean Watson founded what she calls the Caring Institute and has done research on just the presence, a therapeutic, compassionate presence has its own healing benefits. So we are going to have to check the pumps, and we are going to have to take the vitals, and we are going to have to fill out the paperwork, and we are going to have to make the transition to electronic medical records, which is taking up so much more time right now in the transition than patient care. And so as we go through, as we navigate this change, as we go through these transitions, learning how to ground and center our own energy and becoming aware of how my energy impacts the energy of the person around us. It starts really with feeling your energy body. So maybe we could just show them how to feel their own energy body and experience that for the first time.
That would be a great thing. All right.
All right, so 90 degrees to an electronic current is a magnetic field. What's electronic in your body? Your central nervous system. That's why you maybe heard of EEGs, measuring the brain waves, EKGs, measuring the heart. We're using the electronic signals of the body to be picked up on biofeedback devices. So we're going to do something right now that will send electric signals through your central nervous system. Your fast twitch fibers are going to get a louder signal because we're going to do an isometric example. So with your knees, you want to push in. With your hands, you want to push out. Now it'll look like nothing's happening. So I'm going to be trying to separate my arms. I can feel it in my shoulders and my traps. I'm going to try to squeeze my hands together. I can feel it in my hips, in my inner thighs. So you're going to do this for 3 breaths. So you're just going to push in with your knees and push out with your arms. So while Deb is doing an exaggerated breathing and counting the 1, 2, 3s, I'm going to keep telling you. So the brain is really trying to move your hands and really trying to keep your legs from moving. And it's sending these signals and sending these signals. So if the electronic signal gets stronger, the magnetic field around it will get stronger. So now I want you to play the invisible accordion. Just very slowly move your hands together and apart and see if you feel a density there. That is the magnetic field created by the amplified signaling of your central nervous system, and it's always there. Your energy body is always there. We're just not necessarily aware of it. Some people see color, some people see the energy body around living things, plants, animals, people, the way on a summer's day you might be able to see the heat rising off a pavement. Sometimes people see that distortion with their natural vision. So I don't see color or distortion yet, but I can perceive variations in the field, and that's after years and years of practice. I believe that everyone can see color and energy, and everyone can feel color and energy. We're just taught that our invisible friends aren't real, just because we can see them and the adults can't. And we are given messaging that we just learn not to talk about it. And the less we pay attention, the less we welcome that information. It's not that it goes away, it's just more difficult to access because we haven't practiced it. So as you practice becoming aware of your own energy body, you become more sensitive to the energy around people. We have this in our language, right? We say, you know, bad vibes, or you know there's somebody that every time they walk in the room you want to be closer to them or farther away from them. And so we talk about, you're on my wavelength, I can feel your energy, bad energy. So what we want to do is we want to connect the dots between delivering acute care and delivering nursing and being healthy, happy individuals.
All right, so one of the things that's really valuable about this is not only in being able to manage energy are we going to protect our vulnerable patient population, but we're also going to protect the health of our nurses, because if they don't know how to manage energy and they're being exposed to all of these different illnesses and emotions and different things in the environment when you're dealing with sick people, then that energy can also affect their health, in addition to just their stress of trying to be able to do their job. So there's a multitude of things that we can do helping the nurses and learning to understand how to deal with their energy and to help the patients deal with the energy.